This is the case of D-transposition of great arteries. In this image, this is parasternal long axis view. You can see the structure. This is left atrium, left ventricle, and then this is pulmonary artery. From left ventricle, this is right ventricle, then aorta from right ventricle. In this image, this is parasternal long axis view. So this is most anterior part, this is most posterior part. So right ventricle is anterior compared to left ventricle, and aorta is anterior to compared to pulmonary artery. So whenever you get this pulmonary artery from right ventricle, it will always go posteriorly in the beginning. If it is aorta, suppose in case of aorta, it would not go posteriorly, it will go anteriorly initially. So in the beginning part of this great arteries coming out of left ventricle is very important. If it goes posteriorly, indeed it is pulmonary artery, not the aorta. At the same time, you see the beginning part of this both pulmonary artery and aorta parallel. So whenever you get parallel, that means transposition. So in this case, it is D-transposition because there is AV concordance and VA discordance. Atrioventricular concordance, that is left atrium to left ventricle, right atrium to right ventricle, and then pulmonary artery from left ventricle. Why pulmonary artery? Because as begins from left ventricle, it immediately goes posteriorly. You see in this way, because this upper part of the skin is anterior part of body, and posterior part of the skin, the lower part of the skin is posterior part of the body. So pulmonary artery immediately goes posteriorly. At the same time, aorta is also going posteriorly. Both are parallel. The initial part of both should be looked carefully. You see both are parallel. So whenever you find parallel, indicates transposition. If it is AV concordance, then that is D-transposition. If AV discordance with BA discordance, then that will be corrected transposition or L transposition. So this is the case of D-transposition great arteries. Now the next image, this is parasternal short axis view. See the parasternal short axis view. This is aorta and this is pulmonary artery. Aorta is anterior to pulmonary artery or slightly right. Now the next image, this is VSD. In case of D-transposition of great artery, there must be either VSD, SD or PDA or any two or three, because some sort of mixing should be there for survival of the child. So there should always be some sort of either ASD, VSD or PDA or both or all three. So you have to look for ASD, VSD or PDA. This is PFO and there is VSD and PFO in this case. You can see this is PFO. This is fourth chamber view, apical fourth chamber view, and this is fourth chamber view. In this view, what you see, this is aorta. Aorta is anterior and right. So this side is right and this side is left. Probe is directed left. You see the probe P signal. P letter is here. So this is the probe side that indicates left side. So aorta is anterior and right. This upper part of the skin is anterior, lower part of the skin is posterior. So aorta is anterior and right to pulmonary artery, indicates D-transposition of great arteries. In case of L transposition, this aorta is on the left side compared to pulmonary artery. Always aorta is located in comparison to pulmonary artery. So this is pulmonary artery. You can see this is main pulmonary artery and this is right pulmonary artery, this is left pulmonary artery. So even if you are confused with which one is aorta, which one is pulmonary artery, whether this is D-transposition of great arteries or not, you can see this is pulmonary artery because you see this main pulmonary and dividing into two equal parts, that is right and left pulmonary artery. So you can easily see. that also says this is pulmonary artery. Again same thing, you can see this is moving image. This is this is aorta and this is main pulmonary artery, this is right and left pulmonary artery. Again the same thing, whereas from long view you can see here the flow across VSD is from right ventricle to left ventricle, mainly blue flow, sometimes red also, so it is bidirectional, but mainly blue flow. This is blue flow and this is blue, this is red flow. So this is VSD. You can see this VSD is subpulmonary because this is pulmonary artery from left ventricle, so this is subpulmonary VSD, and VSD here the red in color indicating from left to right ventricle, but mostly it is blue in color, so mostly it is right ventricle to left ventricle. So this is D-transposition gate arteries. Parallel arrangement must be seen in the initial part, that is the clue. Whenever you are confused, you have to see whether aorta and pulmonary artery in the beginning part, initial part, is parallel or not. One point is always, I have said, if pulmonary artery whenever arises from left ventricle, it immediately goes posteriorly. This is pulmonary artery immediately goes posteriorly. But in case of aorta coming from left ventricle, it will go anteriorly in the initially. Then it will make arch and then will go posteriorly. So ultimately, if aorta from left ventricle, then it will go anteriorly, not posteriorly. So whenever you find any structure that is coming out of left ventricle, gate artery that is coming from left ventricle, going posteriorly, always pulmonary artery. At the same time, you can see the parallel arrangement, that is always indicates transposition of gate arteries. So these are the points. If you remember, you will not miss the transposition of gate arteries. In this case, D-transposition of gate arteries with VSD and PFO. Thank you.